You're tuned into Life is a Sacred Journey. Every week, we bring a new perspective to aging and caregiving. Here is your host, Micheal Pope.
Good morning, good afternoon, and good evening to all of you in the virtual neighborhood of Life is a Sacred Journey. I am your host, Micheal Pope. I'm just getting everything set up here. It is my honor to be with you here this morning. It's a chilly morning in Northern California. It's actually 40 degrees outside. And so I'm freezing, but really happy to be here and warmed by all of you who continually support Life is a Sacred Journey by showing up every Friday at 8 a.m. So thank you so much for doing that. Thank you for sharing. I just got my 3,000 people that are coming and viewing, and so thank you to all of you. We're achieving these milestones that are recognized by these wonderful certificates from out there. I don't even know who initiates YouTube. So we just want to thank you so much for that and ask you to continually hit the subscribe button, share, let people know that Life is a Sacred Journey exists. So thank you all so much. And to all of you who have been there from the very beginning, faithful followers of Life is a Sacred Journey and supporters of Micheal Pope, I just thank you so much and love you for that. So thank you. I wanted to, let me start by saying something first. I forgot. So Felicia has reached out to all of our guests from the last year, and we have asked them to put together either a video or a little message that we can share with you during the new year, their wishes for you as viewers and supporters of Life is a Sacred Journey. So I want to thank all of them for even considering to do it in this busy season. And I look forward to how Felicia puts that together. I know her title is content manager, but I look at her as a content scientist. She's constantly thinking of new ways that we can bring content to you that engages you and puts you in a position where you really want to share with other people this little gem called Life is a Sacred Journey. So thank you, Felicia. Thank you to all of our guests. And we have some new guests joining us in the beginning of the year. I've reached out to some of the folks in the archives way back in the life of Life is a Sacred Journey, and we're setting that all up now, and we'll do that a little bit more in the beginning of the year just because it's a busy season. I also want to show you something. I always set up my little desk here so that I can have all the things that I want to share with you. Well, first, I need to, last week, or the week before, I don't even know when I said it, I talked about Alice in Wonderland being one of my favorite books outside of The Never Ending Story. I actually have a copy of The Never Ending Story where the print changes color when Atreyu is in the land versus, so I like favorite books. I don't know if I would call them even children's books, but the favorite books that I read as a child. So, but Alice in Wonderland is the other one. I love Alice in Wonderland. And I never really thought of Alice in Wonderland as a children's book. It's more like you got to be more like in middle school or so to really get the subliminal messages of Alice in Wonderland. But it's an amazing story, life story, actually, about life and who we are. And I think it's also one of those things. Alice in Wonderland has the theme of searching for purpose, searching for why. And I think that's why it always resonated with me. But right after, I think shortly after I ended the podcast, this came. It's Alice's Adventures to Wonderland. And it's a pop-up book, you guys. Look at this. Isn't this amazing? Look at, and it has little things here. But look at this. This is, look at this. Isn't this amazing? Look, oh, let me turn it Look at, you can see Alice in there. Oh my gosh. So anyway, Nancy Redding sent this to me. Look at this. Isn't this amazing? I think this is amazing. And it's going to go on my table with all my other treasures next to Stuart Furman and Jane's gift, because they actually go together. And I love it. Thank you so much. Thank you so much. So it's nice to be loved. It's nice to, thank you so much. The feeling of love fuels me. And it's not about the gifts, even though I enjoy. Nancy and I are people who find things that resonate with our souls, purchase them, and we end up giving them a lot of it away. But she and I work together annually on a women's retreat in the Central Valley. And so we're always looking for things that motivate and lift people up. And so thank you, Nancy Redding, for that wonderful book. It is an incredible book. You know, I love it. And I can't wait actually to put it on my table, my wonderful table that I have, sort of my treasures. I can't wait for it to join the other treasures that that just motivate my spirit. So thank you so much. I wanted to talk about this morning about the COVID-19 booster shots and where we are, because yesterday I was a part of a meeting where someone had received a booster shot and they were not feeling well. I told you I got my booster. The only thing that happened after I got my booster is that from my left arm all the way down back through the lymph nodes, they were very sore. I already deal with sciatic pain. So this was like this, from the left side resonating down, but I did not have the symptoms of headache or any of that. So, but a lot of people are experiencing that with the booster shot. We're also experiencing that the folks who had the Pfizer vaccination, they're okay. So you get the first one, you get the second one, but the life potency of both of them, that you have to have both of them in order for it to have really kept you from getting COVID. But what it did do, pardon me, is keep you from getting sick, meaning you may have done a swab and get a COVID test come back as positive, but you would not get as sick as someone who was not vaccinated. And that's across the board, whether it was Moderna or the J&J vaccine, okay? So everyone who had the Moderna, the Pfizer, the J&J had one vaccination, then another. I think it was a 6 to 8 weeks separation. And then we all now are being asked to receive a booster shot. And we may end up having, which I think is going to happen from what I'm reading, we may end up having to have a booster shot annually until it maybe forever, like we have the flu vaccine and all of that. So that's something that I've been thinking a lot about, and what's the impact of our culture to have this another vaccine that is actually a little bit more mandatory, or will be a little bit more mandatory than the flu vaccine, because not everybody goes in and takes the flu vaccine or has the flu vaccine, but we also have that happening with the COVID. So those are things that we just need to think about in our healthcare. I'm boosted, I got boosted, and it was interesting. I was able to go to a, let me make sure I tell you where we got it. Oh, Jade hooked us up at a CVS in Pittsburgh, California, and we went and got it done because we wanted to do it together. Kaiser didn't have an appointment that was open when we were available, and so we went online and set ourselves up there. They did ask for our Kaiser card, for us to take a copy of the Kaiser card front and back, which we did. We had to have our original vaccination cards with us, but we're a part of the CLEAR system, CLEAR. And so our vaccination records are in there, which made it so easy for me to buy concert tickets, made it easier for me to, it will make it easier for me to travel. So I really suggest to all of you, if you can go in, I think it took me about 5 minutes, 10 minutes to get in the CLEAR system. But then I recently went to a conference for our church, and I was able to use the CLEAR system in order to register at the hotel and to register for the event. So it's made life so much easier, because honestly, I don't know where my original vaccination card is. I lost it and was very, very worried that I wasn't going to be able to attend the very conference that I just mentioned. And I went on, I called the state. It was, of course, the spelling of my name got mixed up. It got transposed. And so they didn't have the second vaccination for Micheal Pope, but they did for Micheal Pope with the same birth date, same social security number, same Kaiser number. So we fixed that. And then, the light just changed because the light's changing outside. So I was able then to go back. They had to track it. And then I had got the QR code also, and then I put it into CLEAR. And the booster we've now added to CLEAR. And the second thing that I've done that I think is really important is share your vaccination records with someone else that you love. Just like any other health record, Stuart Furman will tell you, I've read it in his workbook and book that he wrote about caregiving. It's always important to have another person that has your stuff. So my daughter is my designated stuff person. So she has access to my Kaiser and has my codes and everything, so she can set up appointments for me and make sure that I have, my prescriptions and things. And I did that not because I necessarily need her to do that now, but again, thank you, Stuart Furman, Carol and Brett, all of these great writers about caregiving. I realize the day may come or will come where she will have to, and it's much better for her to be on it now, have access. We feel comfortable with each other. I can always call her and say, oh, would you do this or do that? Because then it's another PIN number I don't have to remember, quite frankly, because I can't stand it. So those are the kinds of things that you do as you set up your season of life, where you're aging and aging wonderfully and beautifully, but you want to set it up so that you have the support that you need along the way. So CLEAR, CLEAR, all caps, is a wonderful resource for all of us with our vaccination records, so that it'll be easy for us to purchase tickets when we're ready to travel again, because they're going to make us prove that we have COVID stuff when we travel for a little while longer. And then it's also great for events. I just bought some museum tickets and I'm so excited, and they have the CLEAR thing. I was able to send that in and good to go. So that's the first half of this. The other is when I want to talk about who qualifies for the booster based on the shot, your first vaccination. So if it was Pfizer, the folks that qualify are adults 65 and up and residents in long-term care facilities, people 18 to 64 years old with underlying medical conditions. And we already know the underlying medical conditions are heart disease, asthma, COPD, those kinds of things, diabetes, even obesity. Because all those things affect our immune system. And they put us in risk for a more severe COVID diagnosis. People 18 to 64 whose jobs or living situations increase their exposure to the COVID virus, including healthcare workers, teachers, and people living and working in prisons and homeless shelters. So we already know many of our unsheltered citizens are still not vaccinated, only because of access and us having access as public health officials getting to them all. And so that's an issue. And so when we're working in those communities, having the vaccination and booster is a requirement. It is here at ASEB. All of us are vaccinated, and I'm boosted. And then I think 2 other people, and we tried to stagger the boosting just in case people got sick. So that's also a little pointer. And then anyone 18 and up who received the single shot Johnson & Johnson COVID vaccine at least 2 months ago and wants a booster from Pfizer. So listen to this. Anyone 18 and up who received the single shot Johnson & Johnson COVID vaccine at least 2 months ago and wants a booster from Pfizer. So the booster will come from Pfizer and not from J&J. When can you get it? If you were vaccinated with either Pfizer or Moderna's 2-dose series, you can get Pfizer's booster at least 6 months after the second shot. And that now, excuse me, that same thing applies to the Moderna. My allergies, my throat is getting dry. Pardon me, let me cough and I'm gonna go off here. I'm sorry, my apologies. And so both of those you can make sure you can get the booster once you've had it for 6 months. What are the side effects? The injection site pain that I just spoke about, fatigue, headache, muscle pain, and chills. And these symptoms are usually mild to moderate in their severity, and they usually go away in a few days. For me, the muscle pain went on for a week. And I think it's only also because it got cold at the same time, and I have this sciatic stuff. And so I think it was a combination of both things, but I do know that the injection site and down that left side was very sore. Oh, Dunkin Donuts, Dunkin Donuts, Dunkin Donuts. Okay, this is my favorite Dunkin Donut time of the year because I am now drinking the holiday blend Dunkin Donut flavor of coffee, and it is amazing. I have a shout out to all my Dunkin Donut friends on Clayton Road in Concord, where I go to pick up my Dunkin Donuts. And I have to admit, I've been eating way too many donuts in the last 2 weeks. So I've been going in there and getting a donut. But let's continue. So when they're talking about the symptoms, they're saying that more than 220 million Americans have received at least 1 dose of the vaccine so far, and no long-term effects have been reported to the CDC now that we're in this rhythm of the COVID vaccine. So that's good news. I know that many of us, including myself, was very worried about, what would be the long-term impacts of the COVID vaccine. And, here we are, here we sit. And so they're saying there have been rare reactions. Some people have had some rare reactions, and we've heard about those in the news, and those have been the things that have been lifted up. But for the most part, 880 million people are a lot of people. And if you look at the statistics, there's always going to be a percentage of individuals that have a reaction to things, right? I have a reaction to a lot of things because I'm a walking allergy person. I have allergies to everything. And so, because of that, I'm always very leery of anything that is a vaccine or any medications. Like I don't even take over-the-counter medications for colds. I don't have them very much, but when I've had them, I just suffer through them because they make me sick. Antihistamines give me nosebleeds. And so, everybody is very different, and how we metabolize any form of medication, whether it be prescription or over the counter. So we know that some people will have reactions to the vaccinations, first or second dose or both, and many people will have reaction also to the booster. And one thing doesn't, like one reaction to one isn't really a precursor to the other, because I had a bigger reaction with the first dosage. I got sick. I felt sick. I didn't get sick, but I felt sick. And then I did the second or the booster. So everybody's different. And again, Here at Life is a Sacred Journey, we are never telling anybody how to live their life. We're just sharing best practices that we get from books and from other people that have lived experiences and are willing to share their story. But you just take what works for you, and what doesn't work for you, then, you know, just dump it in the trash and be kind when you dump it in the trash. And that's it. It's, you know, there's a couple of people that came into our messaging last week, and you know, it's like none of this is political, and disease is not political, and health is not political, and living our best lives is not political. The political system may impact those things, but when you know, impact and meaning affect and cause and effect, but at the end of the day, those things are that's who we are as human beings. And when we're living our best life, we experience these things either individually or alone, but we create stories. We create stories that become ancestral stories that are handed down generation to generation. We create stories of our pain. We talk about it, and we share it in a way that is our personal experience. We share our stories, and when we share our stories, some people are impacted in hearing the story in such a way that it promotes change for them, or it makes them think. My thing always is, when I hear stories, other people's stories, it makes me think, you know, where do I see myself in that? What can I learn from that? And I never hear a story trying to figure out where that Achilles heel is in that story to judge it. It doesn't matter to me whether the story is truthful or not. If it's the person's story and they're telling it, it is their reality. And who am I to judge their reality? What my personal goal is if it isn't the truth, is to have discernment to not take something that is not the truth and then manifest it myself and pass that untruth on. That's my only responsibility when somebody is, dishonest. But that's not in my value system. And so I don't really spend a lot of time around dishonest people because they're easily, they easily get tired of me because that's not a part of my value system. And it's not that I'm judging, it's just after a while, they tire of me and disappear from my life. It's not the other way around. So it's yeah, we have to be careful when we take in people's stories, and we have to be real about the fact that everybody's story is unique to them. It may sound like your story, but how they feel about it and how they're living out that story and its impact on their lives is very unique and very different. Yeah, next week we're going to be talking about our why. How do we find our why? I've done, that's something that I've done a lot of presentations on, and done a lot of homework and research, and listened to many more learned people, scholars than myself. And I've put together a great talk on it. And I'm going to share the key points with you here on Life is a Sacred Journey, because these key points have actually changed my life. I've actually shared them all with you throughout our time together over the last 2 years, or soon to be 2 years. But I'm going to put them all together in one podcast so that, it's kind of the end of the year. So it'll be a good way to end the year and a good way to start the year. So please make sure you join us next Friday at 8 a.m. for that podcast, and make sure you share and invite other people to our virtual living room, kitchen, den, wherever you are viewing us. So the other question was, can I get boosted with another brand? And the answer is yes. If you qualify for Pfizer's boosters but don't have access, and you want to get a booster from Moderna or J&J, that is an option based on the new guidance from the FDA and CDC. So preliminary results showed that there was no adverse after effects by crossing them over. I personally did not want to do that. Again, that's all my phobias and all my stuff around pharmaceuticals and medications and all that. So I just, waited. I know that Pfizer got their approval first, and then Moderna got their second, and then I went and got the Moderna. But you can mix them up, and that's your personal choice. But then they said there were no, no federally funded study that showed that there was any adverse effect from crossing over. On the contrary, it said while the boosters from all three manufacturers, Pfizer, Moderna, and J&J, enhance antibody levels, getting boosted with a vaccine from a different manufacturer can have a more pronounced effect on the immune response. What's more, the study showed no new or concerning side effects from mixing and matching. So, they're saying if you mix it, it might actually boost your immune system. So that's a thing to ponder. Maybe next time I'll now that I've read that, I'll have some discernment over it, and maybe the next booster is Pfizer. I don't know, but these are just facts that, again, you have to take and then discern them through your own value checklist and your own personal feelings around all of this. And it says here, if you're thinking about mixing up your booster, it's a good idea to talk to your doctor first, says Dr. Mohammed Sabani, an infectious disease expert at Ohio State University, Wexner Medical Center. I think it's incredibly important, he said, that you have these conversations with your primary care physician so that they can give you the best advice, and then you can have a mutual conversation. You are actively involved in your care plan around COVID, and make it happen. You can get your booster anywhere. You can get it. You can go through your medical provider. You can go to CVS, Walgreens, Safeway. I didn't see it. Yeah, those are the places that I know that you can go. They have everything set up. You make the appointment online and you're good to go. So getting a booster is not hard. You can go to a community care health clinic, bring your shot, bring your vaccination card or your clear or your photograph of it, and you will find that it's easy peasy to get it done. And Moderna has the same guidelines that the Pfizer has, 18 to 64, for people who are working and living in environments where there are congregate folks. Anyone who is 18 and up who received a single dose of Johnson & Johnson at least 2 months ago, that you can have the booster, can be a Moderna booster. Did you hear that accent? Booster. It just came in. So I am really excited that we can prepare to get out of this pandemic. But we know that the Omicron version of COVID is now putting us in a situation where things are shutting down in us. They're trying not to do that. Their mask mandate, all of that, and this is what I'm going to say to you. In 2016, when I traveled out of this country, actually 2016 and 2017, back to back, when I traveled out of the country, every airport that I went through, once I got out in Europe, the Europe area, going through airports, everybody had on a mask, particularly when I got to Singapore and Bali and places like that. In the airport, they all had on masks. I was like looking at them like, okay, what is going on? Why does everybody have on a mask? Well, I found out if people were feeling ill, they put on a mask. When they're traveling and they're in congregate situations, they put on a mask so that they don't get sick themselves. But I was, I was taken aback by it because we were not yet in this situation that we're in now. So what does that mean? It could possibly mean we'll be wearing masks for a very long time, maybe forever. So we need to figure out how we're going to recycle them. Please stop throwing them on the ground. But at the end of the day, we have a virus. We have this thing that is latching on to us and not going away. So we have to do everything we can to figure out. The herd effect hasn't happened yet. You know, Dr. Pearl was with us in 2020 in February or March, and he was talking about the herd effect then. And we were thinking by June, July, August, we would be there, and here we sit with a new strain, and the herd effect isn't happening. And it's, again, we cannot force people to be vaccinated, but we can ask you to please wear a mask so that you're not transmitting the virus if you have it. And because those of us that are vaccinated are actually boomeranging, even if we get affected or infected by the COVID virus, we're not going to get as sick as you. And so we could be walking around with it and get in your presence and you get sick. So that's all I'm saying. Just wear a mask so that, or when you're going to be in these wonderful settings, since Thanksgiving, we see the numbers spiking again, where you're going to be with family and friends, make sure that the family and friends wear a mask if they're not vaccinated, and you wear a mask. I mean, I don't really understand what else we can do, because we can't force people. There's no, we don't have martial law where we're forcing everybody to get vaccinated, even though it's being advised that everybody does globally. We're asking people to wear masks, but again, the mandates around that make people feel that they're in bondage. And so that's not happening everywhere. And so the cry for the COVID COVID virus to go away, we need, how? I mean, I just need to ask that question. How can it go away when we're giving it time to morph, like the alien in the movie Alien? It morphed from one little tiny beast to this huge thing that just ate up everybody. I'm a sci-fi person, if you didn't know that already. So those are the things that we have to worry about when it comes to COVID. We need to continue to wash our hands and use hand sanitizer. I made the mistake last night. I went to Lucky's to pick up some food, and I walked in the store without my mask, and actually nobody caught me. There was nobody in the store but me and a few other people, but it was like, ooh. So shame on Micheal Pope. But very rarely, actually, that's the first time that's happened where I've actually gone in and got all the way into the store and didn't know that I didn't have a mask. That was really weird. So vaccinations are a choice. Boosters are a choice. Wearing a mask is a choice. And so all of us here at Life is a Sacred Journey, somebody's horn's going off, I apologize. All of us here at Life is a Sacred Journey is asking you to make a choice that fits you, who you are, but to ponder a choice that comes outside of yourself and reaches the humanity and protects us all. And we're just asking you to think about it. We're not telling you what to do. We're not forcing our opinion down your throat, so you don't have to react adversely. Breathe. We're just advising and saying, if you feel like it, think about it for a minute and see if it might change your mind and soften your heart to do something different. And we're at least, I know personally, I'm begging you to at least wear a mask. It's now we have all kinds of masks, right? Here's my little miniature one that I used in the beginning to say, get a mask, get a mask, get a mask. So please wear your mask when you get out there. All right. So we're at the end of our time here at Life is a Sacred Journey. Thank you so much, all of you, for always coming back and spending time with us, and for your wonderful notes, for your time, your affection, your words of encouragement, your advice, your everything for the virtual community that you've created among yourselves. When I go back and see your Facebook comments and how happy you are to see each other, and now you're sharing your life stories with each other. Thank you. Thank you for everybody who sent, thank you for the gifts. Thank you for the love. Thank you for the agape. I'm living in agape. I'm living an agape moment with all of you. So next week, we're going to ponder our why as we go into Christmas, the holiday, then we'll come back, and then we'll have a show that I'm hoping that I have somebody that's going to be able to join me so we can talk about not affirmations or New Year's resolutions, but things that we should ponder every day of our lives so that we can be our best selves and live our best lives. So you have spent time in the virtual neighborhood of Life is a Sacred Journey. It's time for us to open our doors so that you can go on to the rest of your day. Have a beautiful day, a wonderful day. Don't get stressed out on the holiday season. Get quiet with it. One of my favorite Bible verses, I was telling Psalm 46, be still and know. Be still and know that this is a time of the season for you not to be running around doing what all that kind of stuff. But it's a time to also be quiet and to be with those that you love and to share the thing agape, which is unconditional love that comes without strings, that comes without bows, that comes without ribbons and fanfare. It is just because it is. So I am Micheal Pope, the host of Life is a Sacred Journey. As always, it is my honor to be here with you. I forgot to, and I would be remiss to say, we have candles lit for all of the individuals, the 800 and something thousand, over 1 million people almost that have passed away due to COVID, all of the people who lost family, for my brother, for everyone that has gone on before in this year, this stressful year. So that's what the candles are about. They are always lit, and they will continue to be lit throughout the remainder of our time as a podcast. So thank you so much. Hug a tree, pet a dog, pet a cat, hug yourself. Know that you matter. And if you have your best friend next to you, hug them. And if not, call them up and hug them with a hello. So have a good weekend. Have a great weekend and be good to yourself. Stay warm. And life is a very sacred journey. Take care. Peace.